could come back in today. It really means a lot to me. We're going to get you taken care of, okay? For today's exam, the first thing we're going to do is an ROF. Now, I explained to you what a ROF last time was, a report of findings. So after I spoke with my clinician, stay there, we decided that you have a case of myalgia. What myalgia is, it's kind of your muscles are really tight and sore. We think that's due to your excessive tail wagging because you're such a good puppy. Here's a treat. That's a good boy. Now what we're going to do to treat that myalgia, Oliver, is we're going to give you some chiropractic adjustments, okay? We're mainly going to focus on that low back near that tail area because that's what's giving you a lot of problems, all right? What we're going to do is I'm going to need to see you twice a week for the first 2 to 3 weeks. Hey, I said stay there. You have to be a good patient, okay? You have to stay there. We're going to come in, see you twice a week for 2 to 3 weeks. After that, we're going to slowly taper you off, okay? Does that sound like something you can do? Go ahead and shake my hand if that sounds like something you can do. Shake. That's a good boy. That's a good patient, okay? Now, I know some of your goals is you want to be able to wag your tail as much as possible. We're going to get you back to that, okay, because you're such a good boy, but we need to ease back into it, okay? So I'm going to need you to sit around a little bit. I'm going to need you to lay around and play with your toys for a couple of days while we try to get this all figured out, okay? As with any medical procedure, there are some risks to chiropractic care. Those can be, those can be sore muscles. Those can be you're a little tight, a little tender. Sometimes it can get a little bit worse before it gets better, okay? I just need you to let me know how you're feeling and what's going on, and then I'll be able to do my best to treat you, okay? Some other risks that might be involved are, strained sprains if something's going on. Everyone's buzzword is the cervical stroke, okay? Now, while we don't cause strokes, we are correlated with them. Go ahead and stay there. Be a good boy. What correlation means is that what do people do whenever they get have a stroke symptom? They get really bad headaches. Where do people go? I know you have a question, but hold it till the end. Where do people go when they have really bad headaches? They come to the chiropractor. Luckily, we did all of those tests, and you were such a good boy. You passed them on. We don't have to worry about you having a stroke, okay? That's a good boy. All right? Some benefits of care. So chiropractic care is awesome for you. It helps your muscles work better, it helps your bones work better, it decreases a lot of pain, and allows you to move a little bit more functionally, okay? And that's really our main goal, Oliver, is we want you to be functional, we want you to feel good, and we want you to be the happiest puppy around, alright? Some other alternatives to chiropractic care, hey, you stay there. I'm going to give you another treat, okay? That's a good boy. Some alternatives to chiropractic care is you could go get a puppy massage. You go get some puppy acupuncture. You could see a puppy chiropractor, even though I'm going to be able to take care of you today, okay? Also, we can work on some stress management. We can give you some more balls, some more toys to play with. We can also make sure your mom's walking you as much as she needs to because puppies need their walk, okay? After all of this, we have this nice sheet that would be listed there, and it gives you our chiropractic philosophy. Now, what this philosophy is, it's not directly related towards me. It is what chiropractic is based off of Carl Cleveland, and it would be on the wall, okay? And we'd have you read that. Now, are there any questions or concerns you have, Oliver? You can go ahead and think on it, not all at once. I want you to think about some serious questions, okay? While you're thinking about those, I'm going to give you another treat because you've been such a good boy. Did you come up with any questions, concerns, comments, or anything, Oliver? Alright, now I'm going to take care of you today, okay? We're going to give you an informed consent, which you're going to sign, and that's just saying that you consent to my treatment. It's okay if you don't consent, you're not going to hurt my feelings. I understand a lot of this can be kind of, hold on one second, can be kind of frightening at first, but I'm going to take real good care of you. I've been doing this for a while, alright? Now what I want you to do to finish up this exam is I want you to shake my hand, informing that you give consent. I want you to set pretty. Can you set pretty? Hey, come on. Come on. Can you set pretty? Hey, Oliver, shake, set pretty. Come on. That's a good boy. And finally, to finish off the exam, can you give me 5? Oh, that's such a good boy. We're going to take care of you today. We're going to get you feeling so much better. Oh no, are you coughing? Did you get a little treat in your throat? Okay. Well, luckily for you, I know the Heimlich maneuver too, so we got you taken care of, alright? Now, are you ready to get a chiropractic adjustment, get that nervous system flowing and feeling better? Alright, well that is the end of my video of how to give an ROF on my patient, Oliver Toby Jenkins McNulty, the first of his name, the first of his clan. If you have any questions, please contact me.